Alright, so guys, we're going to talk about resistance training, we're going to talk about programming, we talked a little bit about progression last week. So, first of all, let's talk about resistance training. What is resistance training? Anyone?
Adding weights or resistance to your workouts.
Perfect, it's resistance. So if you are pushing against something, you're using your muscles to progressively overload and get a response. So long story short, lifting heavy things, okay? Whether that's your body, whether that's a weight, whether that's a tire, it's resistance training. So, really quick, we're going to do some stuff and help Brooks got her science on. Okay, it's not gas. Does anyone know what that is? GAS? Pan-Selig something? It's called General Adaptation System, or Syndrome System. Long story short, anytime something the body is presented with a stimulus, whether it be running, drugs, whatever, one of two things happens. The body either adapts or it shuts down. So, depending on how the stimulus is presented, can determine how the reaction happens. So, if you throw someone at 100 thrusters and 100 burpees their first day, what do you think is probably going to happen?
Shut down.
But if you throw someone at 3 sets of 10 at 10% of their max, or at their body weight or a dowel, do you think there's going to be some adaptation? Now, the question starts coming into how much adaptation you want to get out of it and stuff. So, coming to the next thing. So that's general adaptation. I believe it's syndrome. I can't remember now. It's bad. It's weird.
I think it's syndrome.
What's that?
I think it's syndrome.
It's Pan-Selig, I believe. So we're going to spell this wrong too. It's scientific method. Does anyone know what the scientific method is?
Researching, coming up with a hypothesis, experimenting.
Just in science in general, scientific method, it means you're going to test something and you have certain controls so you can determine the outcome based upon those things. And it doesn't always work 100% in real life. But long story short, if you're testing the effect of sugar on energy, you have a control group that doesn't take sugar. You have one group that's doing sugar, and then you test to see what the result is, and later on you get it. So in resistance training, this is the big problem I'm seeing in the field. I've been totally guilty of this because I got caught up in something that I like to do and not something that was necessarily scientifically founded. Is if someone's doing something random and they're not getting results, how do you change a random program? Structure. But that's the problem with the random program is it's random. There's no way to progress. Versus if we're doing a program that's very scientific and we said for the next 4 months, so if we said for like the next month we're going to do this in this kind of system and it doesn't work, well now it's really easy to say, okay, it's not working, cool, let's progress. Or if it worked, great, let's go to the next level. That's where you can train adaptation. So let's kind of come back over. What would you say the goal of our average client is? Tone,
Get in shape.
get ripped, healthy, okay.
Move.
Move, exactly. So keep those things in mind as we're talking about this. This is going to be talking and treat all our clients like athletes, but on the same end, there's some different things for different people. Okay, specificity comes in here a little bit down the line. So if something's random, can't really change it, right? It's kind of a hypothetical thing, but it's like you're not doing anything at all, you can't stop and rest. It's like that kind of analogy. So coming back here, and this is, I'm not judging anyone, because there's no right or wrong in this, because it's a double-edged thing. Who thinks you need to be sore to have a good workout? Be honest, I mean, I've seen all of you guys kind of like, oh, I'm sore. Deep down, do you feel you've had a better workout if you're sore?
No.
Sometimes.
I'll be honest, I like to wake up and be a little sore in the abs.
Yeah.
You have to ask yourself, where did you learn that? Where did that come into your head that being sore meant it was a good workout? Because we're all like that, I'll be honest. It's ingrained in our culture, like, oh, I'm sore. But it's something they said. It's one of those they. You don't know who they is. There's no proof of that. And here's the thing you've got to start looking at. If someone wants to be sore, you should just hit it with baseball bats at the end of class. Like, they'll be sore. It's a concept. We get caught up in that. Oh, I'm super sore. But it doesn't necessarily make it a good workout. And start looking at like professional athletes, the peak of fitness. I mean, Nick, you got to work with some athletes during last summer or this summer or whatever. If you have an athlete who's training with you 3 times a week but he has to practice, you can't make him sore. Because what happens if he's sore? His practice declines. If he practice declines, he's not starting anymore. If he's not starting anymore, you're either hearing from the coach, you're hearing from him, you're hearing from his parents, and you're fired. So, can you make him better? Can you get him to lose weight? Can you get him to be stronger and not be sore? So, not to say that soreness isn't required. Sometimes it happens. You do something you're not used to, there's going to be some of that. But on the same end, there's also the extreme of, if if I take someone and I do too much and I break down way too much muscle fiber, they end up in the hospital. Now, are we being professionals there? So you've got to find that balance. So, kind of where we're at right now with resistance training, and this is, again, I'm applying this to a group setting. I'm not applying this to a one-on-one program. If I had an MMA athlete come to me, if I had a football player, if I had someone playing volleyball, things would be tweaked a little bit. But the way we're going to be doing our groups training for right now, we're going to be using something called phases. I would still use phases with professional, whatever I'm saying. This is the phase we're going to go into. So the way this is going to be progressing right now, so we're going to start, and we didn't do this, I kind of skipped it. 12, 10, 8, and 6. So right now, we're right here. This is the phase. This is phase 2 or 3, whatever you want to call it. We're doing 10 reps in everything we do, okay? We're doing about 3 to 4 sets. And the intensity is relatively low. Now, why do you think we would start there? And actually, we should start here. Why do you think that's a good spot to start for anyone? What happens to the weight when you're doing 10 reps as opposed to 4?
It's lighter.
It's lighter. As a coach, why is it easier to coach someone doing a movement that's doing 10 reps?
You're able to kind of find a better pinpoint number throughout that 10 rather than through 4. You get a more range of judging.
Think about that. You see it over and over again, which means they're doing it over and over again. You're ingraining into their head. Now, what happens to your overhead squat? That one time when I added weight on it, when you went heavier than you were used to, you were able to do it, but all of a sudden technique broke down, right? You could have still done it, but I stopped you. So if we can get you to know for a fact that with good technique, you can get 10 reps at this thing, we're building the technique up. And especially when it's 10 reps, they're not so focused on, I gotta lift more weight, I gotta lift more weight. We're not getting competitive with it. We're working on our technique, we're working on our form. It's creating a motor program. You're teaching the body how to do it correctly at an intensity where it's not overwhelmed or overloaded. So, 10 reps, doing about 3 to 4 sets. So, at 8 reps, what do you think is going to happen when we go to this? So, this is about 3 to 4 weeks. What do you think is going to happen at 8 reps? 2 to 3 sets, okay. What do you think is going to happen to the weight, or the intensity?
A little bit heavier.
A little bit heavier. And then, same thing, what do you think is going to happen at 6?
1.5 or 2.
It'll probably stay in about 2 to 3. But if you look at the math, and you can do, there's all kinds of programs that will do this, and we'll go through this in school. It's the volume that goes down. As weight increases, the volume goes down. So, the idea here is if I was training an athlete, this should be right around where the competition would be. So, strength would get highest here, and then also you'll start noticing, we'll incorporate, after these heavier things, you start incorporating more explosive movements. We do a lot of explosive movements into the like the metabolic days right now, but this is where your cleans, your snatches, your things. Now think about it this way. We've had a hard time teaching a lot of people the Olympic push. You guys have seen it. It's tough to learn. How much better do you think someone could learn a clean if they've already been deadlifting for 1, 2, 3 months, consistently done correctly with proper technique? Do you think that would